you have the commonest types of arthritis and the rare ones. And then among the commonest, we have the rheumatoid arthritis. Someone is going to give you the pathophysiology to see how this kind of arthritis develop. But these are just brief kind of types of the arthritis which I have. The rheumatoid arthritis, I think everyone has ever heard of it. It's the commonest, in fact, and it's a chronic autoimmune disease, which is normally characterized by inflammation and damage. Because at its chronic, autoimmune means that it's like the body tries to react to some other kind of reaction in our bodies. Then when it happens in the joints, someone end up developing the arthritis. Then another common type of arthritis, we have osteoarthritis. And this is always degenerating. What do I mean? That you find that this is common in elderly, as I've told you. As someone keeps on growing, you find that some of those, like you said, the articular cartilages keep on wearing off. So as a result, it results into a degenerative joint disorder, which is characterized by can be breakdown of cartilage, which is that cartilage you've seen in the diagram, which is in between the bones. It results into breaking or degenerating of the articular cartilages, which is in between the joints. Then there's another commonest one, which is common in young children. As I've told you, it's mostly in elderly, but some other age groups also develop it. Then you have the juvenile arthritis, and this is common in children. Actually, this is arthritis for children. Then there are many, but I think for our discussion, we are going to focus on the commonest because we cannot discuss all of them because there are like more than 100 types. Then we may have psoriatic arthritis, and this one is common in those people with psoriasis. So as we're going to continue, we hear some of the things in there pathophysiology, because the one who's going to research it is going to talk about the pathophysiology to see how the arthritis develop, how the whole process, the interplay of cytokines and the inflammatory processes. Actually, then the last one, depending on any other type of arthritis which we have talked about, the end results is developed into degeneration, which is breakdown or wearing out of tissues of joint. At times it may develop into inflammation, which results into swelling, pain, and redness. That's why you hear even the signs and symptoms, you hear symptoms like swelling, pain, because those are normally the basic symptoms of arthritis, whereby someone is going to swells, they present with pain, they present with redness. Actually, all those are signs of inflammation. Because if arthritis is not developing until degeneration, then the end result is normally inflammation. Then there are also other causes of arthritis, but at the moment, as I've introduced the topic, I'm going to call Chivilango maybe to start from there to talk more about the pathophysiology of arthritis as per our discussion today is concerned. So, Mr. Chivirango, if you are ready, then you can continue from there.
Physiology. Let me share my screen. Share screen. Now, as you can see, we are going to talk about the pathophysiology. How does the disease progress? The first thing is, let us talk about osteoarthritis. Osteoarthritis, as you can see, is characterized by degenerative cascade of progressive cartilage loss, which leads to bone damage. So degeneration means wearing out. Then cartilages and then the characteristic findings in this osteoarthritis include the subchondral cysts, osteophytes, and subchondral plate thickening. So the subchondral cysts, these are cysts. These are filled sacs that form in the subchondral bone. This subchondral bone is just a layer of the bone just beneath the cartilages in the joints. So don't get confused with such statements. Then osteophytes, these are extra growth of the bone tissue that typically develop around the joints. So here they are saying the characteristic findings include subchondral cysts, osteophytes, and subchondral plate thickening. The subchondral plate is just composed of two layers that separate the articular cartilage from the bone marrow. Then they are talking about the interleukin 6, the monokinase, the interferon-induced protein 10, and macrophage chemotactic protein. These induce proteolytic enzymes such as the matrix metalloproteinase, serine proteinases, and cysteine proteinases, and result into the degeneration of the cartilage of the joint collagen. Now, these enzymes that you're seeing the matrix metalloproteinases, the serine proteases, and the cysteine proteases. These ones are enzymes that catalyzes the decomposition of or the digestion of the proteins. And you know the cartilages, the collagen are made up of proteins. So these ones lead to the breakdown of proteins in these supporting tissues of the joint, and then we get what we call the degeneration. So they continue and say calcifications of the surrounding articular cartilages reduces the thickening of the and eventually destroys the cartilaginous matrix. This is what I'm talking about. They eat the proteins, they eat the cartilages, They break down the proteins in the cartilages, reducing their what? Their thickness, and eventually destroy the cartilaginous matrix. So here they talk about old age being associated with a decrement in chondrocyte function, enhancing susceptibility to osteoarthritic degeneration. That is osteoarthritis. Its pathophysiology involves the interleukin-6, the monokinase, and the interferon-induced protein and macrophages that induce the production of the enzymes that break down the proteins in the supporting tissues of the joint, and the joint loses its thickness and hence destroying its matrix. So person will come complaining. Those are the findings that you were supposed to find someone with osteoarthritis. Then we have rheumatoid arthritis. This one is usually severe. Rheumatoid arthritis is mainly a systemic and a chronic inflammatory state caused by autoimmune response to an environment. Autoimmune, it means the body produces antibodies, and these antibodies eat the body cells instead of attacking the pathogen. So the degeneration of the cartilage, and eventually bone is preceded by endothelial cell activation and synovial cell hyperplasia. So hyperplasia is just uncontrolled multiplication of body cells. So there is increase in the number of synovial cells that is uncontrolled in rheumatoid arthritis. Then the pathology occurs following the aberrant production of inflammatory mediators. This includes tumor necrosis alpha, interleukins 1, 6, and 8, and the others following the exposure to an antigen pathogen. You know what the interleukins do from the osteoarthritis? They induce production of enzymes, the proteases that break down the what? Then we talk about the gout. The gout is mainly due to increase in uric acid in your blood. So they are talking about the monosodium urate salts of gout precipitate as needle-shaped crystals. This crystallization is more likely to occur in cooler body parts and with acidic conditions. So destabilization of these deposited intra-articular uric acid crystals lead to interleukin-1 mediated inflammatory response, leading to the typical acute gouty arthritis flare. When you talk about the acute gout arthritis flare, we mean this acute arthritis gouty flare is just characterized with intense pain in the affected joint. But here they are talking about, they continue and talk about the pseudo gout. So in pseudo gout, the inorganic pyrophosphate from the chondrocyte combined with the calcium to form calcium pyrophosphate dihydrate. So this crystal is deposited in joint spaces that have a predilection to osteoarthritis.